Phil, would you mind turning your camera off, please?
John, we're not quorate yet, so don't start.
And welcome to those in the chamber and welcome to those who are joining via Teams. This is the Wokingham Borough Health and Wellbeing Board, Thursday the 10th of June. So first item on the agenda is election of a chairman for the 2021-2022 municipal year. And any proposals, please? Thank you, John. Any votes in favour? Oh, sorry, I need a seconder.
I'll second.
Thank you. As you can see, I'm a little rusty at doing this physically. Right, any votes in favour? Thank you. Thank you very much. I now need to appoint a vice chairman for 2021-2022 municipal year. John?
May I propose Katie? Debbie, sorry. Debbie.
I'd be happy to second that. So can I have votes in favour, please? Thank you. Congratulations, Debbie. Apologies for absence.
Steve Moore, Meriden Peachy and Martin Sloan.
Okay, next item on the agenda is minutes of the previous meeting, which was held on the 11th of March 2021. Can I ask for a show of hands to indicate that they're a true and accurate reflection of the meeting? Any declarations of interest? Do we have any public questions? No. Any member questions? No. Now, what I'm going to ask is if Ingrid is on the call, if she could give us a brief update on where we are up to with COVID, surge testing, and any other key information that might be of interest to the board.
Good evening. Thank you, Chair. I'll just share my screen if that will work. There, if you can let me know when you can see that.
We can see that here. Thank you.
Okay, great. Thank you. So just to give a brief update to the board, this is the table that you're used to seeing about the COVID figures across Berkshire. This is always one day out of date. So the case rate currently, just from this evening, released from the government, is that Wokingham's case rate is 91.7. And that the South East rate has increased to 33, and indeed the England rate has increased above 50 now. So you can see that across both Berkshire, but also the South East and England, the rate is rising. You can see that we share our rising rate with our neighbours in Bracknell Forest, Reading and Slough, although West Berkshire and Windsor and Maidenhead are currently escaping that trend. In addition, this second column here shows that our positivity rate is rising alongside our neighbours, and that means that there's an increasing number of positive people in every 100 that are tested, as we would expect to see with rising cases. Within that picture, and following identification of Delta variant cases not associated with travel, as the board knows, we are undergoing a surge testing operation of 4 wards within our borough, Bullmarsh and Whitegates, Evandens, Norreys and Westcott. This involves testing of all residents over the age of 12 who live in these wards, and for those that aren't aware, there's a postcode checker on the website to check if your postcode is within those wards. And it also includes those who work or go to secondary school within those wards. So surge testing involves PCR testing. It is for all those, even if you are vaccinated once or twice, and even if you take regular rapid tests. All test sites are listed on the Borough Council website, and it's a mixture of our static council testing sites, but also mobile testing units which are supplied by the Department of Health and Social Care. In addition to the testing at test sites, we are undertaking door knocking of every resident in those 4 wards to inform them and advise them about the testing operation and to encourage them to get tested within it. We're also distributing tests to all schools and businesses in these areas, and we're providing specific support to vulnerable residents within these wards to help them engage in the surge testing. We're currently at the end of day 4 of this operation and have seen a good uptake from our residents so far, and the operation is going well. And clearly we need to try and continue that engagement and uptake into our 2nd week. The operation will last 2 weeks. It's important for us to note that these are PCR tests, as I said, and so residents will get notification of their result in 24 to 48 hours, but we will not get any clear variant results from these tests for at least 2 weeks. So just for everyone to know that those results come through at least a fortnight later. And obviously we'll be monitoring the data closely as it comes in across the coming weeks. Happy to take any questions, Jim.
Thank you. Any questions either from people in the room or online for Ingrid? David.
Why were those wards selected? Is that because of their population, or because that's where you felt it would be heaviest, or what?
Thank you. Those wards were selected at the time of the initial cases coming through, and those were the wards with the highest numbers of the Delta variant cases not associated with travel and with an increasing number of cases.
Any other questions? Online? No? Okay, Ingrid, I will just say I think this has been a huge logistical exercise and a fantastic effort by everyone involved with this to get this off the ground. So thank you very much. Right, if there's nothing else, we'll move on to agenda item 8, which is strategy into action. And that, I believe, is Ingrid again.
Thank you, Chair. I think Matt might be introducing the item.
Matt?
Yes, good evening, board. Yes, just as way of introduction, I just wanted to go through a few points and then hand over to Ingrid. So I just wanted to talk to the board and outline the plan we've got around our wellbeing strategy. So we have our current strategy and we need to decide today to roll that strategy forward for a number of months. The reason we need to do that is because of our plan around adopting a new strategy. We have in this paper the draft Berkshire West Wellbeing Strategy, which we want the board to note today. And then the proposal is that we have a series of workshops through the summer for this board to work through each of the priorities in a bit more detail to flesh out then a plan for Wokingham going forward. So we roll over the old plan and then we'll work on the new strategy through the summer and then look to adopt that in September once that work is done. So I just wanted to outline that as a kind of strategy and a plan for adoption of a new strategy, and the component parts of this paper talk to that. Ingrid, do you want to just step the board through a bit more of the detail?
Yeah, absolutely. I'm going to just share my screen again. So if you can let me know when you can see that.
Yes, go ahead.
Excellent. So as Matt said, within this agenda item, there are several papers. Apologies for all the reading required. The first is the draft of the current Berkshire West Health and Wellbeing Strategy, which I hope you will have seen. As you will have noted in looking through it, it is a high-level strategy across all 3 local authorities that highlights key priorities, which I'll go through in a minute. And the role, really, what I want to outline is how we're going to make each of those high-level strategies relevant for our residents in Wokingham over the coming few months to bring back to this board in September. So this Berkshire West Health and Wellbeing Strategy has been in development since April of 2019, and you will see the journey or the outline of that journey, which is on page 12 of the report or page 32 of the agenda. And what that has led to is a series of priorities which are listed here, which are to reduce the differences in health between different groups of people, to support individuals at high risk of bad health outcomes to live healthy lives, to help children and families in early years, to promote good mental health and wellbeing for all children and young people, and to promote good mental health and wellbeing for all adults. So what we are proposing to work on across the summer months and bring back in September is our Wokingham Strategy into Action document, which will have this sort of outline, or at least include these elements, which will be an introduction, but also to distill down some of the public consultation and engagement that's happened in making that Berkshire West strategy, and to bring out the Wokingham bits of that, to clearly define the need and the priorities within Wokingham for each of those areas highlighted through the Berkshire West strategy, and then for each priority outline the current work that's happening, where we might focus some of our work going forward with our partners, and then to identify those key partners for that work, and then to outline the governance and ownership under the board for each of those priorities. How we propose to do that, as Matt had just alluded to, and some of you will have seen fall into your diary already, there is a series of informal workshops that we will have, one around each of the priorities, to discuss our approach, to discuss where we want to focus efforts, and to gather the views of the board on each of those. Alongside those, there will be a series of engagement opportunities with key stakeholders through the summer, and the creation of a continuous document through that time, updating as we get feedback across that work. We'll then circulate a draft comment and make sure that we are ready to bring back both the Berkshire West Health and Wellbeing Board strategy, but also our local action plan for approval together in September. This gives an outline of some of the consultations, both within the informal workshops, but also with some of our key partners along the way. We have around our board our partners, which include Children and Young People's Partnership Board, Community Safety Partnership, the Wokingham Integrated Partnership, and then our current action groups against our current Wellbeing Board priorities in health inequalities, physical activity, loneliness and social isolation. And you will see, having read the West Berk strategy, that actually those priorities do fall quite well within our current partnerships and groups. And at this stage, this is our proposal for that ownership, so that obviously the Children and Young People Partnership Board might own children and families in early years, and an element and part of the children's mental health priorities, with the Community Safety Partnership incorporating their work with vulnerable people. The integration is obviously a cross-cutting theme, as is physical activity, and we have health inequalities already as an action group, and loneliness and social isolation might need to expand to incorporate a broader mental health remit, but that seems to fit relatively well, and obviously the detail of that needs to be worked out across the coming 3 months. The expectations with this are that areas or partners within the Wellbeing Board take ownership for the delivery of these strategic priorities, and then report back to the Wellbeing Board every other month. And section 3, or appendix C of this agenda item, is an example of how that might be achieved. So the action groups that are already in train and set up have dashboards that are in progress. So these are draft, although they are now updated every other month, and show how partners can come together around each of these priorities, demonstrate the work that's going on, report back to the board on it, both at a local level but also at a national level, and ensure that we incorporate all the good work that's happening, but also through doing that, identify some of the gaps where there might be additional opportunities to work together to improve the health and wellbeing of our residents. Currently, that dashboard reporting largely includes 4 elements, one of which is a progress report of the action group since the last meeting. Another is the reporting section, so that each partner around the table gets to report their local work against this priority. And then there's an area for information around annual reports or national guidance that's been published since the last report to the board. And finally, a national reporting which might be updated on a less regular basis, so annual figures, for example, in the public health framework indicators. And then what we need to do is ensure that all of our partners and relevant stakeholders involved in these deliveries of these priorities are obviously engaged in doing so and pushing forward the areas for Wokingham residents underneath those priorities. So that's all I was going to say on that, but happy to take questions.
Thank you. Any questions for Ingrid? David?
So may I make a couple of comments?
By all means.
Thank you. I mean, I was just very pleased when I read this to see the need on page 19 of the report to explore an integrated universal approach for children for their different areas of work with children, and how important that is in the early years before they're 5 and so on. I'm sure Carol Carmus and you, Ingrid, and people know that, but it was lovely to see that. And also, I was in some ways even more delighted to see tackling about social factors that create risks to mental health and well-being and physical health. And so often we forget those and think it's going to the doctor that makes a difference to our health. In fact, there's an awful lot of things that we can do that make an awful lot more difference to our health than going to the doctor, and so how important that is too. So thank you very much.
I fully agree with all of that. Basically, any other questions? I think Katie has her hand up.
Thank you, Chair. Obviously, this has been a huge amount of detailed work as such. I'm just wondering, Ingrid, on all of the plans, have we examined those and undertaken a quality impact assessment? Because what we're learning as part of the vaccination programme does generally show that we've got issues regarding how we're supporting individuals, especially from deprived areas, people from different ethnicities, as well as those people who maybe have a disability, or those people from the Gypsy and Romany community. So actually, how are we at the moment ensuring that with regards to all of those actions, that we're also looking at it in the lens of an equality impact assessment?
Thank you, Katie. Ingrid, if I don't know if you would like to respond to that.
Yeah, thank you, Katie. I just only just to say that obviously health inequalities is at the heart of what we do, and that there is a health inequalities priority per se, so there will be a focus on that, but obviously we need to ensure that that's also a cross-cutting theme, and that each of the other areas of priority, such as children and young families, or such as mental health, it also includes health inequalities in its work going forward, and hopefully we'll be able to draw that out at the workshops.
That'd be really, really good. And also, I'm just thinking about it, it's also about looking at it from the point of view of the workforce. And actually, I think I've just recently done some work on what is going to be the overarching population growths. And when you break it down into where the biggest populations are going to be coming through, we know actually that's going to be generally for the over 80s over the next sort of 10 to 20 years. But we're going to have a population gap, especially from our point of views of the 21s to sort of 49s. So we also need to factor in about the workforce as well, in actually how do we ensure the overarching strategies that you're talking about here, the culture is actually changed, but also how we're ensuring that we're bringing in new workforce as well. So I'm just quite keen about making sure that actually we tie in these pieces of work to whatever the plans are going forward at the moment on workforce development as well.
Thank you. Any other questions or comments? No. Well, I think what I would say is the recommendation is we review and approve the development plan for the strategy into action section of the Berkshire West Health and Wellbeing Strategy. We invite further input from board members on this development plan, and we invite board members to participate in the workshops as part of the development of the strategy into action plan. And I think my sole comment would be this is a real opportunity for any board member to have an input into a detailed Wokingham strategy and put something down that really is going to make a difference for our community. So I'd appeal to anyone who can to get involved. Thank you. Right. Oh, my apologies. We need a vote on that. So all those in favour? So now we are on to item 9, which is on page 121 of the agenda, which is the Wokingham Integrated Partnership Update and End of Year BCF reporting. I believe this is Lewis.
Good afternoon, board. If you just bear with me a moment, we'll share my screen and we will go from the top and work our way through. There we go. So, as you're aware, every year we have to respond to the NHS England with our return for the Better Care Fund. A much shortened return this year, as most people didn't manage to submit a formal plan, as we weren't asked to. But we did, however, obviously agree a plan locally, because you've already seen that and you've already seen the progress that we made towards it. The key points: we met the national conditions and we had a Section 75, which is appropriate legal framework to share finances. Income and expenditure matched, which is always a good start, and the programme did not overspend. The key feature of our return was based around 3 statements that were made by NHS England, which we had to agree with and then write a comment regarding. So overall, the first statement: overall delivery of the BCF has improved joint working between health and social care. It was felt by the integrated partnership that we strongly agreed with that. We met very frequently during the pandemic, which enabled us to, as an integration board, the key personnel to meet, plan and implement actions quickly. Whilst many other integration boards were not meeting, we made the decision to double down and meet more frequently and meet weekly. This enabled us to get our primary care network clinical directors in and make them become key partners very quickly. With regards to our BCF schemes that were implemented as planned in 2021, unfortunately, we disagreed with that, predominantly because we had a very stacked programme plan, which we do this year, which you've all already seen, which we developed obviously with all of our partners, and we weren't able to implement all of that, which obviously then meant this was due to the pandemic mostly, unfortunately. With regards to the last statement, the delivery of our BCF plan had a positive impact on health and social care integration locally. Again, we strongly agreed with this, and BCF has enabled the Wokingham Integrated Partnership to develop into a mature partnership. And I do think, and it was felt by the partnership, that there's real and meaningful change that results of the work that we do. And obviously it's enabled us to support with pandemic response better as well. The next slide was around challenges that we'd had. So the first one would be around choice and supporting choice. During the pandemic, we haven't always been able to offer as much choice to our residents as we may have wished, especially with regards to care provision, as there were issues with safety and capacity to make sure everything was okay. And the second challenge is obviously the pandemic itself. It has been an enabler for some areas of joint working, but it did obviously get in the way of some of those less pressing matters that we were to discuss. Here you'll see some of the highlights of the BCF programme, or the Integration Board programme this year. Lots of really good work that we've done. I think embedding population health management was a huge piece. Some of our, just to highlight some of the fantastic work that's been done with our voluntary sector as well, which have been very proud to work alongside them with regards to Friendship Alliance and Mind as well. Welfare calls, multidisciplinary team meeting. It's lots of really great stuff. Some of the highlights for our programme this year so far. Obviously, we're now in June, so we have been in delivery for a couple of months. So we form project groups for the majority of our projects on the programme, and we're completing our project initiation documentation. So we're pushing that forwards. Our ongoing projects like Joy continues to grow, and the app is being used by more people. We've had the agreement today to get some more folk trained to use that. The Moving with Confidence continues to support the vulnerable in our borough, and our Friendship Alliance continues to support with digital enablement, as well as a meeting with our the lonely in our community. We have initial work started on Dementia Alliance and Mental Health Alliance, and our Mind Wellbeing service is now fully staffed and heading into full implementation. The integration team continues to support with the COVID-19 pandemic and the response to that. Some of the stuff that we've been involved with most recently is a pilot with our contract tracers to contact people that from cohorts 1 to 9 that hadn't yet managed to be vaccinated. We saw an increase in one of those groups by 26% for one particular practice. We've supported with organising vaccination pop-up events at the Asia Mosque, which we wouldn't have been possible without our voluntary sector colleagues and our PCN and CCG support. So thank you again for that. We're supporting our CCG colleagues with implementation of a vaccine bus, and we continue to support with organisational refocus of discharge to assess and support schemes following the peak of the pandemic, and hopefully enable us to move towards the new normal. A bit of a whistle stop there, but happy to take any questions.
Any questions for Lewis, please? I had a question, Lewis, actually, which was basically the Mind service, which you mentioned was moving in towards, was fully staffed and ready to go. When is it hoping to launch?
So I believe that we've already started the work with 1 or 2 practices, and I think that it should be the end of this month, beginning of next month, I think, where it should be operating a more full service. So the service is operational, but at a lower level because it hasn't been fully staffed. So staff are going through their induction process currently, and I think it's the end of this month, beginning of next month from memory, but I can come back to you, sir, with an exact date should you wish.
Thank you, that would be very helpful.
No problem, sir.
So I think we're asked to note that report. So if there are no further questions, we'll move on to the next agenda item, which is item 10, which is the Wokingham Community Safety Strategy. And I believe that is for Narinda to present.
It is. Good afternoon, board. I'm just going to share my screen. Great, super. Hope that's sharing.
Yeah, we can see it.
So the community safety strategy is in its current draft format. The current strategy that we have at the moment is due to come to an end at the end of June this year. As part of that, the Community Safety Partnership has a statutory duty to produce a strategy for the borough that looks at all of the crime and disorder issues and to consider those in terms of an independent review of all of the issues that have occurred across the borough, and then come together as a partnership and pull together a plan and a strategy of how we deem we are going to tackle the key issues such as antisocial behaviour, drug and alcohol misuse, and domestic abuse. So those are the sort of key issues covered by the Community Safety Partnership within this strategy. The partners, as the board will be aware, is made up of the Borough Council, Thames Valley Police, the Fire Service, and the PCC, or the Police and Crime Commissioner, the Berkshire West Commissioning Group, the Healthcare Trust, Youth Offending Services, and the National Probation Board. So that's the Community Safety Partnership in terms of its partners. So the strategy, which is circulated in the papers for board members for consideration, brings together information considered and data considered across all of those partners that was available for the last 5 years. So we did a strategic assessment as a partnership, a real deep dive of all of the data that's been available across those different partnership areas, and had a look at really what the key areas of concern for the Community Safety Partnership are. The results of which are 3 strategic key themes that have been drawn out from that data. So the first one is around listening to the needs of concerns of local residents and taking action. That's the first strategic theme that's been highlighted as a key issue that we'd like to tackle. The second one is intervening early and preventing issues escalating. And then the third one is around working together to protect our most vulnerable residents across the borough. So those are the three strategic key aims. And then sort of within those, within the first one, mainly we cover antisocial behaviour and listening to the key issues that each of the different neighbourhoods at a level. So Wokingham Borough, we recognise as a partnership that Wokingham Borough is made up of lots of different geographical wards that are differing in their needs as neighbourhoods. And what this first strategic theme outlines is that we as a partnership will listen to those different themes. So what is right for Wokingham? Wokingham, for example, is possibly not right as a neighbourhood priority or fits as a priority for the north of the borough, or perhaps the east or the west of the borough. So the first priority is really about listening to those needs, whether it's antisocial behaviour, whether it's rural crime and illegal encampments, or whether it's burglary or vehicle crime related, and then responding in relation to those key geographical areas and putting together a problem-solving plan that brings together those partners to tackle those. The second one is about intervening early and preventing issues escalating. I'm sure everybody will agree that sort of trying to get in as early as possible is a real key factor in preventing acute issues and then having to deal with issues and concerns at a real acute level. So the second strategic priority is really around protecting adults and children, but also helping them to access services at a real key early stage, and to be able to give them information about what is available locally for them to access, and how we can help them at that really, really early stage as a partnership. In particular, with response to young people, for example, trying to catch them early to stop them going down the wrong path in terms of reducing that periphery of young offending and then reducing that offending cycle, as it was. The other thing the second priority looks at is also trying to tackle those that may be drawn into activities that perhaps are, for example, as a result of not having a diversionary activity. So really looking at the needs, again, going down to that neighbourhood level and looking at the diversionary activities that are available for young people, and having a look at whether we are providing the correct things that you know, that young adults are wanting to see in terms of diversionary work. And that builds into the government's violence reduction strategy, of which the partnership is beginning to embed and develop its work to reduce knife crime and robbery work within the borough in respect of that. And then the third priority really pulls together the work to protect those that are the most vulnerable residents in our borough, to ensure that victims and vulnerable residents have the access to information that they need, but also that we are doing all that we can to help those that may be experiencing domestic abuse, antisocial behaviour, hate crime, and other vulnerable residents that may be drawn into being targeted by criminals or offenders by very nature of the fact that they are more vulnerable. For example, take sort of the older populations within our borough, and them being particularly targeted with relation to fraud offences. We've seen that sort of skyrocket over the last 12 months with the pandemic issues. So that's sort of a general overview of the strategic priorities. Within the document, we then go into some more specific aims as to how we actually, as a partnership, are going to deliver those for residents across the borough, and how we're going to work together to deal with those. I won't go through those in too much detail, but I'm happy to take questions that people have. And then if we sort of scroll down a little bit further, I'm just going to take a bit of a jump down to the page below, just sort of talking about COVID within the strategy. And clearly COVID-19 has, over the last 12 months, had an exceptional set of circumstances within which we as a partnership have continued to operate. And we've seen some dramatic changes and some unusual trends really over the last 12 months. So whilst we as a partnership realise that those are possibly, some of those are here to stay, such as we've seen huge reductions in burglary, vehicle crime. We've also seen a notable increase in offences such as antisocial behaviour in parks and green spaces and in residential areas, car meets, and also a rise in domestic abuse issues, which we've had to pivot our services so that they are fit for delivery in pandemic times. We've consulted very widely on the strategy with a full public consultation that was open for over a month, and we had a good response rate with sort of the highlights being that most people that responded were concerned about antisocial behaviour issues in their neighbourhoods. So that that was sort of the main crux of the consultation feedback that we received. So with that, I'm going to stop my presentation and I'm happy to take any questions, Chair.
Thank you. Any questions on that report? I can't see any. I had one though, basically, which is I know you and I have been in correspondence over the last week about the domestic abuse contract, the new one with Cranston. And I understand basically the point about it being accessible to wider groups, basically, and minority groups who perhaps weren't covered so well by the other one. And I understand as well, basically, that it's an increase in investment, but my question was more obviously, women make up 90%, I believe, if I remember correctly, of the people who suffer from domestic abuse. I was just looking for a comment on whether the amount of funding and services open to women across the borough is still the same or greater under the new contract.
Overall, due to our increased investment as a local authority, the proportion available in terms of service amounts will have increased to women across the borough. So overall, our overall investment means a greater ability to respond and a better and wider service, both for women as well.
Whoops, thank you. That was very clear. Katie and then Phil, please.
Thank you. It's a really clear report. Just going on to about COVID, are you seeing now a surge of also people coming forward with reporting incidents? It'd just be interesting to know.
Interestingly, that was something we did expect, but at this moment in time, we haven't seen that huge sort of surge in reporting that we were really expecting. So no, we haven't seen that. We have seen a slight drop in the number of incidents reported to us, but in terms of the number of incidents reported through to police colleagues as incidents, which is interesting. But when we overlay that with the information with respect to the local provider, actually it's not consistent. So actually what we're seeing is perhaps less incidents being reported to the police, but more or less a similar or a maintained level of people accessing the local service. So not a real drop or even a surge. We've seen a consistent level coming through. So that's sort of the picture locally at the moment.
Can I just ask Debbie Milligan from a primary care perspective? Debbie, from your experience, I know that you're seeing a huge surge in primary care. How do you have an indication about how many people might also be coming in with having issues about community safety or any of that domestic abuse and bits and pieces? Are you seeing an increase at all?
No, so at the beginning, obviously, we saw the surge, unfortunately, in child abuse at the beginning of the COVID situation. But no, we haven't seen any changes in that. I think just to kind of piggyback on and allow myself a question is, you know, I think it's difficult sometimes for people to admit that they are a victim of abuse. And it's how is this board, you know, trying to educate people that things aren't correct and there are services out there to support them. Just thinking about certain ethnic groups, sometimes, you know, it's very difficult for particularly women to actually admit that they're in an abusive relationship just because of the families around them, and that to say anything basically means they have to give up all of their family. So how, you know, what are we doing to get the information out there that people can tell us? And I think also my other view would be, do we know everything that people are worried about? Because again, you know, even if you're on a road where, you know, people are running up and down and screaming and shouting, you may not want to say, actually, I've got an issue here, because you are then concerned you might be targeted if you feel as though, you know, you're vulnerable yourself. So were we getting, when you did all that interaction with different agencies to find out, you know, what the issues were we getting information, you know, from Phil's team at Citizens Advice, you know, to say this is what people are telling us? Sorry, quite a few things there.
It's quite a few questions. So shall I answer that one, Chair, before we go on, or would you like?
Please, and then we'll go to, after that, to Phil, then to John.
So in terms of, first of all, the information that we're putting out, Katie, just to say that this year we've seen the DA Act come into force, so that received royal assent at the end of April, and brought about a new definition for domestic abuse. And there is also a real clear emphasis that was quickly followed by a amount of funding, which is going to allow us to really ramp up some of the increased communication campaigns that we have started during the period of the last 12 months in terms of COVID, and really getting that information out to local residents, but really will allow us to really, like I said, ramp that up and get some additional resources behind those communication campaigns, really, both in different languages and in different places, so in different forms. So one of the really good things about sort of COVID has been that we have really reassessed our social media platforms and the ability to really reach people in different forms. So we will continue that really good work, and also together with some of the sort of communication campaigns and training that we did for some of the sort of less obvious places, but when you sort of target them, they completely make sense. For example, we did a huge amount of training together with Thames Valley Police for supermarket staff to be able to recognise signs of abuse and how to sort of broach people. Pharmacy staff, again, making safe spaces locally for people to go in and access services and make those calls. And also we're going to be rolling out some information and some training for hairdressers as well. So it's a real good, large, impactful pieces of work in terms of communications coming down the line to really help us really get this message across. So that was the first one, was about communications. Sorry, I can't recall. What was the second question?
I think it was just, are we sure that we've got everybody's voice? You know, are we picking up, you know, from CAB saying we're getting some themes, and, you know, from that point of view?
We certainly did in the first lockdown. We certainly were receiving increased information from people that were calling in to Citizens Advice, for example, for unrelated issues, but you know, were disclosing as part of the calls that they were perhaps not in a safe environment to be able to have conversations. So they were sort of quickly followed up in terms of safety planning and being able to follow them up. So there has been some additional work together with voluntary sector colleagues that we've been able to do during the last 12 months that has enabled us to get the voices of different communities and different people. And furthermore, we're doing more, reaching out to more voluntary sector and community community leaders and charities, etc., in terms of our implementation of the Domestic Abuse Act and our response to that in terms of our housing needs assessment. So there is more consultation work coming down the line, more far-reaching than the work that we've already done.
Thank you. Phil.
Hi, Narinda. Looking at your understanding the concerns of residents, especially through organisations, groups like NAGS, can I request if there's some consideration to pretty simple but summary feedback to the NAGS, just to remove assumptions from the people that attend them that certain subjects have been raised when they haven't. But secondly, also, the best way to tell someone that you've been listening is to tell them back what you've heard. So maybe we can reinforce the feeling of engagement for those groups and reassure them that their concerns have been heard.
That's really useful. Thank you, Phil. We definitely have, in terms of our next steps and future developments, some work coming online in terms of how we do that satisfaction work, really, even with the NAG. So treating them very much as customers and saying, you know, this is what you've told us and this is what we've done as a result. These are the actions that we've undertaken as a result. But that's really useful. Thank you.
John.
Well, first of all, Narinda, thank you very much for all the hard work you put into this document, which is a culmination of really 2 years. We as an administration in the last couple of years have invested heavily in this area. Your appointment, the domestic violence manager, seems a very strange title, but it's the title, and the antisocial behaviour manager. With the bringing back of the subcontracted services with the PPP, we should then have the statutory responsibility for those functions, and merging those or melding those with the police and our localities team will enable us to hopefully focus on the areas of deprivation which we have, which being the borough of the lowest level of deprivation, we should be able to tackle successfully. So I think that is really great paper, and the teams and the organisation, we need to work with the police so that we are a single unit and with the health services attacking the same problem. So thank you very much for their work.
Right, if there are no more questions, I'm going to ask for a vote in support of this strategy. I think that's definitely passed. So thank you, Narinda. And now we'll move on to agenda item 11, which is the Wokingham Borough Wellbeing Report. And I believe Ingrid is going to present this.
Hi, thank you very much, Chair. So I won't take too much time to present this item. The reason being that you have the report in front of you, and you have this evening had a summary of the Berkshire West Health and Wellbeing Strategy, which is one item in the annual report. You've also seen the strategy into action dashboards from the action groups, which is a further item. You've had the annual report of the Better Care Fund also addressed in the annual report, and the Community Safety Partnership strategy also addressed in the report. So we really have discussed many of the aspects of the report already across the meeting. I would like to express my thanks to partners across the board, including Children's Services, Children and Young People Partnership Board, Community Safety Partnership Board, the Integrated Partnership Board, and NHS colleagues, all of whom have contributed to the annual report for our Wokingham Borough Wellbeing Board. I think that what does need to be noted by the board is that the context across 2021 for this Wellbeing Board report was unprecedented. The COVID pandemic dominated lives of our residents and the board's partner organisations, as well as our own workforce. And as we all know, had an immediate and in some cases devastating impact for some of our residents. And we all work mindful of the long-term impact that this pandemic has that lies ahead of us, some of that already known and some of it still to emerge over the coming few years. The work of this board through the Local Outbreak Engagement Board and its partners has been tireless over the past year through an unprecedented response which was mounted again for the pandemic. It's important also to note, as we consider this annual report, that much of this work continues through into 2021 and beyond. So reading through this report, you will have noticed the impact of COVID across all services, all programmes of work and all partners, and how it has impacted the work across this board over the past year. And I would like to ask the board, in its adoption and recognition of this report, the work and the progress that has been done in spite of the pandemic in many areas across our partnerships and with our partners sitting at the board today. That's all I was going to say, Chair.
Thank you, Ingrid. Any questions, comments, thoughts for Ingrid? Right, looks like everyone's happy with that. So I will just ask the board to review the annual Wellbeing Board report and the achievements for 2020-21, to note the establishment of the 3 Wellbeing Board action groups who will support the board to identify the ongoing priorities for 2021-22, and to recommend the report to council. And can I ask for a vote of all those in favour, please? Oh, question from Katie and a comment from Matt, I believe, and Carol. Oh no, sorry, everyone's in favour. I should pay attention. Thank you. So the next item and the final item is the forward programme, which is on page 161 of the agenda. So I'm not going to read that out. I just ask for any comments, any alterations, anything else anyone wants to be considered. Okay, that's that. And the final thing to mention is obviously, again, the workshops which are coming up, which were mentioned earlier on, which are obviously informal, but just to encourage anybody who wishes to attend, to please come and participate and help us shape the Wokingham strategy going forwards, which will obviously sit underneath the wider NHS West Berkshire strategy. So with that, I will say thank you very much to everyone and good night.